Early on the morning of the 17th, around 12:30 a.m., the infant Nathaniel D.A. Santos, Matthias Silva, lost his battle with 4 rare disorders. He was born prematurely, and with 4 of these ailments, he transformed himself into a magnificent example of faith, strength, and inspiration. With only having 8 months to live, he was in a coma after going into cardiac arrest while having surgery at the Santa Marcelina Hospital in Sao Paulo. Before we start, can we get this video to 1,000 likes? Please hit the like button and subscribe to the channel. On the Facebook page Toros Paula Nathaniel, the boy's mother, Karina de Santos Matthias Silva, used the page today to inform the public of Nathaniel's death. After being in a coma for several days, suffering a cardiac attack, pneumonia, and undergoing numerous operations, this true warrior is now alive and well. The life and times of Nathaniel in the words of his mother. I discovered that he was exceptional when I was 5 months pregnant. According to the physicians, he suffered from hydrocephalus, a brain abnormality that develops when a youngster has an excess amount of fluids in his or her head. Following my morphological ultrasound, it was discovered that I also had lumbar holoprosyphilis, which is a very rare and aggressive condition. I was also found to have microcephaly, and all of the top gynecologists told me that he had no chance of survival, that he would be born dead, that my kid was not compatible with life, and that I would have to terminate the pregnancy. But I decided to have Nathaniel nonetheless. I made the decision to allow him to be born. Another ultrasound was performed before the delivery, and the results revealed that he would be born without life. Nathaniel had an open skull, and he didn't have an eye. As it turned out, as soon as the delivery was completed, he would only have 2 hours to live. Every morning when I wake up, I witness a miracle breathing on my left side of the bed. God is capable of performing miracles. He is still able to do miracles. It took only 8 hours for my son's operation to be completed, despite the fact that it was not Gazelle who was operating, but rather God. In addition, he does not require 16 hours to perform a miracle. All he requires is the knowledge that he is unfit for life. He is deformed and will not live, and even if he is born alive, will die, suffocated by not having a brain. My son, and one of the greatest miracles of rare diseases, is almost completely cured. It shares a lot for all to see. The miracle that God performed in my son's life, a child who it is nice to wake up and see you breathing by my side during life to hope, and his hope in God when you discover it is the end. I'm quite glad and appreciative, because it is difficult to lose someone we care about, and even more so, a son. The infant was laid to rest in the city of Adrenaline SP. What is hydrocephalus, and how does it manifest itself? Hydrocephalus is defined as an abnormal buildup of fluid in the ventricles, or cavities of the brain, which are located deep within the brain. The extra fluid causes the ventricles to enlarge, placing pressure on the brain's tissues as a result of the increased volume of fluid. Cerebral spinal fluid (CSF) is a clear, colorless fluid that surrounds and covers the brain and spine, providing protection and cushioning. When the CSF is flowing normally, it bathes both the brain and spinal cord before being reabsorbed into the bloodstream. However, when the fluid is not flowing normally, it can cause problems. The body normally creates and absorbs the same quantity of CSF throughout the day on a daily basis. The accumulation of CSF, on the other hand, can occur when normal flow or absorption of CSF is interrupted. The pressure created by an excessive amount of CSF can prevent the brain from functioning properly, resulting in brain damage and possibly death. Fortunately, there are therapy options available that can help to restore normal CSF levels. Despite the fact that treatment is frequently beneficial, treating hydrocephalus may necessitate many surgical procedures. Hydrocephalus is the most prevalent cause of brain surgery in children under the age of 5. Many people are able to enjoy regular and productive lives after receiving treatment. I'm confused about the numerous types of hydrocephalus. Hydrocephalus can affect anyone at any age, but it is more frequent in infants and elderly individuals. It is also known as hydrocephalus of the brain. It is possible that some of these cases are related to anomalies in the brain and spinal cord that occurred during pregnancy. Generally speaking, the two most common kinds of hydrocephalus are referred to as communicative hydrocephalus and non-communicating hydrocephalus when the flow of CSF is interrupted after it leaves the ventricles communicating hydrocephalus and shoes. The term communicating refers to the fact that CSF can still flow between the ventricles since the channels between them are still open. In this form, it is possible that reduced flow and absorption of CSF into specialized blood arteries known as arachnoid daily will result in a buildup of CSF in the ventricles, resulting in communicative hydrocephalus and other complications. A non-communicating hydrocephalus occurs when the flow of CSF is obstructed along one or more of the tiny tubes that connect the ventricular chambers. The following are two other kinds of hydrocephalus. Hydrocephalus ECZ vacuo occurs as a result of brain damage induced by a stroke or another type of injury. In certain instances, the brain tissues surrounding the ventricles shrink, and as a result, the ventricles become larger than they should be. Strictly speaking, this is not a true case of hydrocephalus, but rather a condition known as a hydrocephalus. Look-alike normal pressure hydrocephalus can occur as a result of bleeding in the brains, cerebral spinal fluid, head trauma, infection, malignancy, or as a complication of surgical procedures. Many people, however, acquire NPH even when none of these risk factors are present. As a result of the increase in cerebral spinal fluid in NPH, the tissues surrounding the ventricles are able to compensate, and the fluid pressure inside the skull does not increase. In addition to causing issues, walking and bladder control, NPH can also cause difficulties thinking and reasoning. NPH might be confused for Alzheimer's disease under some circumstances. Who is afflicted by this disorder? Due to the fact that hydrocephalus can affect both children and adults, and that it can manifest itself later in life, it is difficult to estimate the number of people who have developed or are now living with the condition. Hydrocephalus was determined to be responsible for 6% of all pediatric hospital admissions in the United States in 2003, according to a data assessment conducted by the University of Utah in 2008. According to some estimates, 1 to 2 out of every 10 newborn babies are born with hydrocephalus.